Go.
All right, so we're here with our model patient, and we're going to be injecting Kybella. That's our product that we have here. So Kybella, it came out about a year ago. It's an FDA-approved product to treat unwanted double chins. So everyone's double chin is a little different. Some people require some more Kybella, some people require some less. But in general, it takes at least 2 treatments with Kybella to start seeing changes in the neck region. And so what we've gone ahead and started here, we've placed a grid on our patient's neck here, and you can see all these little dots, and that's more or less where we're going to be injecting the product. I've also gone ahead and given her a little bit of numbing medication there, so she's going to be pretty numb in this area. However, this product, when we start injecting it, it can be somewhat painful. Typically goes up for the first 5 minutes, and then we just ice the area, and after that the pain kind of goes away. Most patients have a little bit of an ache for a few days, up to about a week, along with some swelling. So, are you ready? Mm-hmm. You excited to get rid of that thing for Thanksgiving? Mm-hmm. Okay, we're gonna get rid of this little double chin area here, and I've got everything laying out here for me. Can we go ahead and get the ice ready? And as soon as we're done injecting, we're gonna put ice right on our neck because we want to control the swelling and also the pain. Yeah, if you can just leave it right there. So once we start injecting, things move pretty fast. I just want to get through the injection and put the ice on quickly. So you ready? Here we go. And then Julie, can I ask you to just uncap those? And then I'm going to ask you to hand it off to me. Do you want to Snapchat here or Instagram or anything? Or are you good to go? You don't want to text anyone? No. Okay. All right. All right, here we go. Yeah, just go ahead and uncap all those first, and we'll be good to go. So for the most part, I'm injecting the area right underneath the chin here to kind of the area of the hyoid bone, which is this part of the neck here. And then it's not FDA approved to treat the jowls, but I've been working a little bit more towards treating these jowls areas in some folks. In our patient here, we're not going to be treating that area. We're just going to focus on the double chin area here. So here we go. Is this coming out okay on the video? Perfect. All right. You doing okay? Mm-hmm. Starting to feel the ache a little bit? Mm-mm. No? And I'm going to use the extra bits that we have to kind of come in the middle, which is kind of the area that's most unwanted. And the ice? We're all done. That was it. How'd you do? Really? Yeah, nothing? No. Nothing at all. All right, so do you guys have any questions at all? That was the whole procedure there. So you did really well. It didn't hurt at all. So that's partly using a trooper, partly probably the numbing medication that I gave you at the very beginning. So I'm just going to ask you to ice that area over the next day or so. When you go home tonight, just keep some ice on it. And you can shower, you can get it wet, you can do whatever. If it's swelling tomorrow, just continue to put some ice on it. And then that's really about it. Do you guys have any questions at all? That was pretty quick, huh?
That was very fast.
Yeah, so this is, in the past, all we had to treat this area was liposuction and neck lifts. And so this is a great product right now where we don't have to go to the operating room to treat this unwanted area. So great, you did excellent. Thank you.
How long does it last?
Once the fat cells are gone, they're gone. Really? So one concern has been when the product first came out that there's going to be a lot of loose skin left after the fat goes away. But what we've actually been noticing is that the skin actually tightens as well in that region. So as much as I thought I'd have to come back a lot of times and treat some loose skin, it really hasn't been the case. Now everyone's a little different, everyone's got a different neck, of course, but the hope is that it's just treatment with Kybella, and you won't need surgical treatment as well.
Is there an age range?
I'm sorry?
Is there an age range?
No, there's no age range. I mean, you can start, anyone in their 20s going up to 60s, 70s. The thing is, those folks in their 60s and 70s, that's typically a different style neck. There's a lot more going on there. So most of those patients are more surgical candidates as opposed to a candidate for Kybella. But if they are a candidate, that's something I'd love to talk to them about, and we'll just have to assess them and decide what's best for them. Okay, you did great. Thanks, guys.
Great.